Hello, everyone. Welcome to our webinar today. We will be covering a new report from the Center for Gun Violence Solutions at Johns Hopkins University. This report covers alcohol misuse and gun violence. We're going to kick it over to Josh Horowitz, who is the co-director of the Center for Gun Violence Solutions, in just a minute. Give everybody a chance to join here. For the record, this is being recorded, so if you'd like a copy, please reach out to us at the end. Josh, why don't you get going? Thank you so much.
Well, thanks. Thanks, everybody, for being here. My name is Josh Horowitz. I'm the co-director of the Johns Hopkins Center for Gun Violence Solutions and one of the founders of the Consortium for Risk-Based Firearm Policy. Thank you for joining the webinar to discuss our new report highlighting the dangerous intersection of alcohol misuse and gun violence. The report was released earlier this month by our center and the consortium. The Johns Hopkins Center for Gun Violence Solutions addresses the public health epidemic of gun violence in the United States by combining the expertise of highly respected gun violence prevention researchers with the skills of deeply experienced gun violence prevention attorneys and advocates to advance equitable policies that reduce gun violence. We focus on conducting high-quality gun violence research, developing and implementing evidence-based firearms policy, and providing unique educational programs and opportunities. The consortium, which is staffed by members of our center, is composed of more than 30 leading experts committed to advancing evidence-based gun violence prevention policies. The consortium is best known for its development of the Extreme Risk Protection Order policy and has published 6 reports offering evidence-based gun violence prevention policy recommendations. In turn, federal and state policymakers have come to rely upon the consortium's recommendations to craft legislation and executive action and to inform implementation efforts which continue to shape the policy landscape of the gun violence prevention movement. In this new report, we have turned our attention to the role that alcohol plays in gun violence. Alcohol is an underappreciated risk factor for gun violence. And through this report, we want to start a discussion about ways to mitigate this risk factor, providing non-exhaustive lists of recommendations for advocates and policymakers, and explore racial equity concerns. We are very grateful to the Joyce Foundation for supporting this work. Unfortunately, Dr. Jeff Swanson from Duke isn't able to join us today, but we have a great group of panelists for you to interact with today. And I remind people that they can ask questions through the Q&A function, and I really urge you to do that. So our first panelist will be Sylvia Villarreal. She's the Director of Research Translation at the Center for Gun Violence Solutions and the Managing Director of the Consortium for Risk-Based Firearm Policy. She's the lead author of the report, Alcohol Misuse and Gun Violence, an Evidence-Based Approach. As a Director of Research Translation at the Center, she leads the development of reports and other products to bridge the gap between knowledge gained through research and its application in policy. Her research background in gun violence prevention includes evaluation of community-based programs in vulnerable communities, the effects of U.S. gun policy abroad, and gun trafficking. Dr. Rose Kogawa is an assistant professor in the Department of Emergency Medicine at the University of California, Davis, and a faculty member at the Violence Prevention Research Program. Dr. Kogawa uses epidemiology and causal inference methods to identify opportunities for violence prevention and to evaluate social and firearm policies. Dr. Kogawa's topic of study include comprehensive background check policy, neighborhood-level resource allocation, and poverty reduction programs. And Michelle Spencer is the Associate Director of the Bloomberg American Health Initiative. She is also the Deputy Director of Equity and Community Partnerships at the Johns Hopkins Center for Gun Violence Solutions and an Associate Scientist in the Department of Health Policy and Management. Michelle is a public health practitioner who focuses on the impacts of health equity, racial disparities, and health outcomes through community-based initiatives. Welcome all the panelists, and thank you so much for joining us today. I'm going to start with Sylvia. We've got a new report out there. Tell us about the report. Tell us about some key data, and give us a high-level view of the policy recommendations that everybody's available. Everybody can see the report, but let's walk us through some of this report and some of those recommendations.
Thank you, Josh. I'm really excited to be here today and to have the opportunity to share our report. And if I could say what the report is about in just one sentence, I would say that alcohol misuse is a risk factor for gun violence. And having said that, we found solid and impactful research evidence that points to different ways in which alcohol misuse is a risk factor for gun violence. From research done by public health experts like Charles Branas and Coons, we know that an estimated 1 in 3 gun homicide perpetrators drank heavily before killing their victims. We know that 30% of gun homicide victims drank heavily before being killed, and that a quarter of gun suicide victims were heavily drinking before they died by suicide. And of course, these numbers are talking about heavy drinking, but this could be much higher depending on the threshold definition we use for misusing alcohol. And I just want to point out for clarity that throughout the report, we use the term alcohol misuse. And we use it to refer to excessive use, abuse, and dependence, which all have distinct definitions. And considering the context in the United States, where gun ownership and access to guns is pervasive, and where gun sales have skyrocketed since the beginning of the COVID-19 pandemic, we realize that alcohol misuse is strongly associated with violent crimes and domestic violence. And when you pair that with a gun, you really have a recipe for disaster. We also found that both of them, alcohol misuse and gun violence, have disproportionate impacts on people of color and their communities. And there's also great research studies around DUIs done by our colleague Rose Kagawa and others at UC Davis, which she will tell you more about, that point to alcohol misuse as a strong predictor of future violence. And this evidence led us to develop 2 broad policy recommendations. And one is limiting access to firearms by persons with a record of alcohol misuse. And the second one is limiting access to guns when and where alcohol is consumed. And you can find more details about what exactly we are recommending for each policy in our report. But what I can say now is that these policies are supported by data. They take into consideration the gaps that exist in the current firearm alcohol state laws and the racial equity considerations we did using the racial equity impact assessment, or how we call it, the REIA tool for gun violence prevention that the consortium authored in partnership with other organizations committed to racial equity. And maybe I'll get a bit ahead of myself here, but we also know that the environment where alcohol is sold and consumed plays an important role. So that is something that we needed to acknowledge, just the fact that firearm policies work best when we address the environment with other policy solutions like limiting alcohol outlet density.
Okay, thank you for that review. I know you worked really hard on the report, so and along with a lot of other people, but I commend you for spending so much time with this and being the lead author in that. Rose, the report is based on a lot of the report is based on your on the research that came out of your research center that you're part of. Can you tell us about that research? Because that, for me, when I started thinking about, I've been thinking about risk factors for a while, and it would really open my eyes to what we're missing as a movement when we don't talk about alcohol. And so can you tell us about how you've identified, through your research on alcohol, DUIs, and firearms, how that's a risk factor and what it means?
Yeah, definitely. And thank you so much for having me. So given this link between risky alcohol use and violence, there has historically been interest in limiting firearm access among people with known alcohol abuse or alcohol dependence disorder or other risky alcohol use behaviors. And one way to do this is by using convictions for alcohol-related offenses like DUI as firearm prohibitors. So when someone undergoes a background check for a firearm purchase, if they have a certain number of DUIs in a set period of time, they would be prohibited from purchase. And so we wanted to look specifically at this question of what is the risk that is associated with a DUI conviction. And to do this, we had a population of about 80,000 handgun purchasers who purchased a handgun in California in 2001. And we followed them through time until the end of 2013 to see, what arrests and convictions they might accrue over that time period. And we were particularly interested in the group of handgun purchasers that had DUI convictions at the time of purchase. And we compared them to people who didn't have any arrests or convictions at the time that they were purchasing that handgun in 2001. And what we found was that those that had a DUI conviction when they purchased the firearm, they were more likely to be subsequently charged with a major violent crime like homicide, rape, or aggravated assault, a major violent crime involving a firearm, or an intimate partner violence offense in the years following purchase. And our estimates suggested that they had nearly 3 times the risk compared with purchasers with no criminal history. We also found that people that had DUI convictions at the time of purchase were had about double the risk of dying by suicide in the years following purchase. So this is an observational study, or these were multiple observational studies. They're not an evaluation of a DUI prohibition or a DUI prohibition policy, but the study does identify DUI convictions as risk factors for violence in this population. And previous studies have shown that firearm prohibitions based on known risk factors, such as convictions for violent misdemeanors, are associated with reductions in violence among those affected. So it's reasonable to think that a similar policy based on a DUI conviction would yield similar reductions in risk. But any state that does choose to implement a DUI-based prohibition, I think evaluating that will be very important for having a more accurate understanding of the effectiveness of this kind of policy.
Go ahead. I'm sorry.
Well, if you want to ask a question on that, there's just one more nuance that I wanted to add, though. So firearm possession laws, they need to be enforceable. And one of the main ways that they are operationalized is through our background check system, either at the point of purchase or prior for states that have purchase or licensing laws. DUI convictions provide a really clear marker, and they're identifiable within the existing records that are in our background check system. However, whenever we rely on the criminal legal system to determine who can and cannot legally purchase or possess firearms, we introduce racial inequities in legal ownership. And this is because African American and Hispanic men are overrepresented in the criminal legal system, in part due to racial biases and disproportionate police presence and patrol in communities with large African American or Hispanic populations. And so there were a few things we wanted to know about this in terms of the results of our study. One, we wanted to understand the degree to which these inequities exist and for whom. And so one thing we did was we looked at the rate of having DUI convictions as compared to the rate of being involved in an alcohol-involved crash, which is a clear indicator of actual driving while impaired by alcohol. And we wanted to compare that ratio across racial and ethnic groups to see if that ratio was similar across racial and ethnic groups. And in fact, we found that white men were convicted at lower rates than Latino men with similar crash rates. Now, the ratio for African American men and American Indian men was also elevated when compared to white and Asian American men, but these differences didn't reach statistical significance. That might be because our sample wasn't sufficiently large to observe these differences in a statistical sense, or it might be for other reasons, but we did conclude that DUI convictions are in fact subject to the racial biases that we see in other areas of the criminal legal system. Given that, and this is the last point I'll make, but given that, we just wanted to see whether DUI conviction was actually still a marker of risk in each racial and ethnic group that as measured in this study. And we looked to see whether it was, and we didn't find any evidence to suggest that this was not so. So DUI, despite this evidence that there is racial bias in the DUI conviction rates, DUI conviction remained a risk factor across racial and ethnic groups. What this means is that implementation of these recommendations requires really careful consideration of racial justice and equity in order to preserve the potential health benefits while preventing inequitable inequitable impacts on legal firearm access.
I'm going to bring Michelle into the conversation, then I want to go back to this question because I think it's a very important question. Michelle, you've worked at the initiative for a while. You were involved in developing the whole strategy behind this. And one of the initiative's core areas is addiction and alcohol addiction. And can you tell us about why that's a core area and how that affects all the other, and tell us about a little bit about the initiative and why this is such an important prong of the initiative, why alcohol abuse, and mitigation is such an important part of your work.
Well, thank you, Josh. And it's really great to be here this afternoon, to be with you and Sylvia and Rose for such an important conversation. I appreciate the question, the overall framing of the initiative and our focus areas. And I will say, as introductory to the initiative, is that we really work to improve the declining life expectancy here in the US. And we do that really through education, through research, and through practice. The initiative tackles 5 of the complex health challenges that are really impacting life expectancy here in the US. And those are environmental challenges, food systems, addiction and overdose, violence, and adolescent health. And, I would just note that adolescent health is the only population-based area that we focus on. And we do that because we know that there are large numbers of adolescents who are disconnected from work and from school and from family. And we know that when there is this disconnection, there are lasting impacts that include economics and education and many other social factors. And we also know that there are correlations to many of the other focus areas when adolescents are not engaged. And so these issue areas of ours are really broad. And the challenges certainly extends to all areas and all communities in our country. We do know that meaningful progress in these areas can be made through public health efforts. And one of the things that we are very focused on in the initiative, again, through our research, our practice, and our education, is how we incorporate a lens of equity and policy, and certainly the data in the way we approach these issues. And so your question around why addiction, why overdose, why various substance use is one of our core areas, is that we see that the research has noted that declining life expectancy, we see those numbers, and we also noted that the rate of fatal drug overdose more than doubled in the US from 2014 to 2021. Research has noted that overdoses is now responsible for more than 100,000 deaths each year. So our focus on addiction and overdose is because we know that there are policy lenses, there are research lenses, there are opportunities for us to really think about how we can make a difference through public health and through healthcare systems approaches that we can employ, as well as treatment and a range of mental and behavioral health services to addressing substance use disorder, to addressing the issue as it relates to alcohol abuse as well. One of the things that is noted in the report is that a study done by CDC found that there's excess alcohol consumption causes about 1 in 8 deaths of adults between 20 and 64 years of age. And I believe that data was between 2015 and 2019. And so the initiative really seeks to illuminate public health approaches to really address substance use disorder, certainly again with the focus on transparency and prevention and with the lens of health equity. So we emphasize the need to engage communities and using the data that really supports a tailored approach to the way we think about this. And so when you say why substance use disorder, why addiction and overdose, we see the data, we recognize what's happening in communities all across this country. One of the things I think Rose noted, or maybe it was even Sylvia, the disparities between Indigenous communities and Black communities and white communities as it relates to substance use, as it relates to alcohol and addiction. And so our approach must be tailored. And so the initiative is very clear that we need to look at these issue areas that are impacting health, impacting life expectancy. And how do we do that? Using the tools that we have and the tools that public health helps us to engage with.
Fantastic. Let me just ask you a follow-up question. I've been impressed that the initiative is deeply involved in education, but also policy. And as you know, there are policy recommendations in this report that you helped us craft. Can you tell us a little bit about why policy in the public health setting?
You know, Josh, the first thing I want to say is why not policy? I think for us, policy approaches are the things that help us to are the levers that we use, not just in our approach to this report, but the way that we think about how we go about and how we are seen in spaces. Policy is what allows us to have impacts in the way that we're able to have those impacts. Policy recommendations are the things that we're able to use for our elected officials, for our community organizations, for our faith-based organizations. It is the tool by which we are able to do the work and think about how we're doing that work in different spaces. When you think about policy, you engage different stakeholders. You engage stakeholders in the academic setting, in the legal system, and we engage our elected officials. And so policy is the tool by which we're able to ensure that the work and the impacts that we're hoping to make are actually done. We also bring our stakeholders to the table when we think about what these policy issues are and why we need to implement certain policies. One of the things that stays with me is my role, not just in thinking about equity, but in thinking about partnerships and who are the partners that need to be at the table when we are thinking about how we are implementing or making recommendations for certain policy decisions. And part of that is who's going to be most impacted by the policy decision that we are making or that we are trying to recommend. And so your question about policy is spot on in that policy has to be the way that we think about how we engage with our work, how we do our research, and who are we bringing to the table to help us identify what are some of the opportunities for us to advance the issue area that we're working in.
All right, thank you. I'm getting some terrific questions in the Q&A, and I hear you, I see you, I hear you, and we're definitely going to get there. So keep putting them up there, and we will get this involved. So let me go back to Sylvia and Rose and dig a little deeper on the equity issues here. So we see a strong risk factors from alcohol, but we also wanted to make sure that with just what Michelle mentioned on the implementation phase, that this is done as equitably as possible. Sylvia, do you want to jump in on some of the ways that we developed recommendations for implementation on that? And then, Rose, I want you to follow up. You talked a little bit some of the factors around implementation. I want to follow up on that just after Sylvia talks.
Yes, absolutely. So before I go into the risk factors and the implementation, I think it's important to say that most adults in the country drink alcohol, and many drink heavily without engaging in firearm violence. And keeping that in mind, alcohol consumption is a contributing factor that increases the risk of firearm violence. And from the research studies that we included in the report, we know that gun owners are more likely to misuse alcohol than those who don't own guns. And from the data, we know that over 15 million gun owners are estimated to binge drink or drink heavily in any given month. And that is a huge chunk of people that are more likely to carry their firearms in public. And having said that, there is a demonstrated link between alcohol misuse and the likelihood of three main things. And one is exhibiting risky firearm behavior. And by that, I mean carrying guns in public, threatening others with a gun, or unsafely storing guns. And there's a great paper by Jeff Swanson and other colleagues that showed that the individuals who met the criteria for alcohol or illicit drug abuse or dependence were over 2.4 times as likely to report impulsive, angry behavior and to also carry guns in public compared to those who did not misuse alcohol. The second risk is engaging in interpersonal firearm violence. And here, we found compelling evidence linking alcohol misuse to an increased risk of perpetrating interpersonal gun violence among legal gun owners. And here is a great series of studies from Rose Kagawa and other colleagues at the Violence Prevention Research Program at UC Davis that found that among legal gun owners, alcohol misuse measured through DUIs increases the risk of interpersonal gun violence, and that includes intimate partner violence. And the third risk is dying by gun suicide. And studies show that on average, 35% of people who died by gun suicide in the US consumed alcohol prior to their death. And here, I mean any amount of alcohol. And that is a really large percentage. And many people are not aware of the huge risk of this particular intersection of alcohol and guns. And the last thing I want to say, now that I'm talking about these risks, is that the burden of this compounding crisis is not distributed equally, as Michelle and Rose Kagawa have been saying. They disproportionately affect people of color and their communities, and also the harms that are brought by these racial disparities present a very troubling paradox. And if I have time to give you an example, we know, as Rose mentioned earlier, Black and Latino men are more likely to experience gun violence, but Black and Latino men are also more likely to report dependence symptoms and negative social consequences of drinking, even when the rates of alcohol dependence and abuse are roughly the same or even greater among white men. And this is called the alcohol harm paradox. And it really just explains that while groups that have been historically marginalized consume less alcohol, they experience more alcohol-related problems. And in the same logic, we also, as I mentioned, know that Black and Latino people are also disproportionately affected by gun violence. And it's those same structural factors that Michelle and Rose already talked about that lead to this paradox in gun violence victimization as well.
So thank you very much for that addition, and I really appreciate that. And so, could you mention some of the ways that just to build on what Michelle was saying, the ways that in the report we talked about equity and the implementation side as being extremely important to I guess take into effect that paradox.
Yeah, so for each of the policy recommendations, the two broad policies that I just mentioned earlier, we developed racial equity impact assessments for each of them. And we found that basically we need to involve the criminal legal system in this recommendations. So what we did here was study the data, how people of color disproportionately are affected by these policies, and proposed a few solutions to mitigate these harms.
And those solutions are spelled out in the report for people who want to go implement these, right?
Yes.
Okay, thank you. Rose, turning back to you, I was really struck by the fact how deep your research is on this. It wasn't surface level. And I think sometimes when we think about equity, we also want to see there are people who are being harmed, people whose lives can be improved if we have this policy too, right? So you were talking about intimate partner violence, you were talking about homicide and rape being prevented. What do we know about the prevention factors that go into this sort of weighing how to go forward with this policy?
Right. It's always a matter of striking the right balance. And I think this is sort of a yes and answer, where we have identified a risk factor. We know it's associated with subsequent violence, but the devil's in the details in terms of, preventing any harmful unintended consequences of implementing a policy like this, like the inequitable limitations. If DUI convictions are influenced by racial bias, then that leads to inequitable access to legal access to firearms, and also can increase the penalization of illegal firearm carrying along racial lines. But then, we also have to balance that. So implementation is incredibly important to think through and to do it carefully. And the report does highlight some of those really specific recommendations, like having prescriptive guidance about when to stop drivers, thinking through the placement of DUI checkpoints to make sure that they're aligned with, places where there's higher rates of alcohol-involved crashes, and making sure that there's some journalists and primarily have identified instances where DUI checkpoints were placed more frequently in African-American or Latino communities than they were aligned with where alcohol-involved crashes were occurring. So aligning those sorts of things, but also, at least in California, DUI convictions, a really small proportion of them arises from DUI or sobriety checkpoints.
I didn't know that. I did not know that. That's interesting. Yeah.
Yeah, it's a really small fraction.
Oh, I didn't know that.
It's more, I think, would be related to just general, roving patrols and police community contact. So thinking through where police are more generally is also important.
All right. Well, thank you for that. Before I move from this topic, Michelle, is there anything you wanted to add to this? I mean, it's all going to be throughout the webinar, but I wanted to know if there's anything you wanted to respond to or any before I move on to the next question.
I think the only thing I would well, I'm not sure. I think Rose or Sylvia has mentioned racial impact assessments, and I almost want to just take a step back for audience members who may not know what racial equity impact assessments are, and I just want to note that. And of course, it's in our report. And like you, Josh, Rose, when you noted that DUI, that these checkpoint stops don't yield that large number of arrests, I would love to dig a little bit deeper into that, because to your point, we bring our own biases to these issue areas, and over policing, as you noted, in communities, particularly communities of color, and yet you don't see the number, the percent increase of these DUI arrests happening from those checkpoints and those stops. It's yet another area of research that I think we should be doing, but not necessarily doing it on communities or in communities that are already over policed. But let me go back to the first point that I was trying to make. Racial equity impact assessments for our audiences is really important tool that is used, that, as Sylvia noted, to really identify and assess factors on racial equity that should be considered before a policy is implemented, or before a report is published, or before a decision is reached. And I just want to make sure that we frame that for those of you who are like, well, what are these racial equity impact assessments? And it's certainly an important tool that we use in the center, in our approach to the work, and certainly in our approach to providing documents or authoring any documents in our center.
All right, thank you so much for all that explanation and go ahead.
Thank you, Michelle, for complimenting that. Yes, so I think another thing that it's important to mention here, now that we're talking about the racial equity and the solutions that we offer in the report that Rose has touched upon, is that there is also a growing push in criminal justice reform to limit police involvement in traffic stops. And this is due to its potential racial disparities in enforcement. But these efforts include ending pretextual and investigative stops related to minor traffic violations that are not related to safety. But driving under the influence and DUIs of alcohol is one of the biggest traffic safety concerns, and 30% of deaths from traffic accidents involve drunk driving. So this really warrants the involvement of law enforcement agencies, although we need to think about solutions on how to establish protocols to mitigate racial disparities and unconscious bias.
All right, thank you for that terrific discussion. I want to move one last question to Michelle, and then I'm going to get into some terrific questions in the chat. So I'm going to get into the Q&A. But Michelle, why sometimes in our field, especially in gun violence prevention, we talk about a lot of risk factors, but alcohol seems to be one of the biggest risk factors and one that's talked about the least. Why is alcohol sometimes a hidden risk factor? Any thoughts on that? Anybody can jump in, but because you work in the field so much across beyond just guns, I just wonder, Michelle, if you had any thoughts on that. Why is it almost a hidden risk factor?
Yeah, that's an interesting question, Josh. I think Sylvia touched on that a little bit earlier, right? Like the proportion of all of us who consume, or many of us who consume alcohol, is probably not viewed in the same way. I don't remember. I think maybe Rose said it. It's an underappreciated risk factor to substance use disorders, right? Like we know that there are behavioral health approaches to addressing alcohol use and alcohol misuse, but I think we see that alcohol is sold and consumed in spaces in our communities, and it's not seen necessarily as a trigger or in the same way that other substances are viewed. And we see that we know that there are a higher percentage of alcohol selling establishments in particular communities. And so I think a hidden risk factor in the way that we see and view alcohol, perhaps in terms of even how alcohol is studied, or is alcohol, it's the need for alcohol to be seen separate, perhaps at times, from other substances that we sometimes think more about and we study more of. But, I will say, Josh, that in communities, particularly underrepresented and under-resourced communities, there are larger numbers of alcohol outlets and alcohol selling establishments. And I think this goes back to some of the social factors that we talk about, some of the ills that comes from having a large number of these alcohol establishments in underrepresented communities. We know the impacts. I said, like, the initiative focuses on one of the things is on environmental challenges, and some of those environmental challenges are where things are placed in our communities, particularly, and I say our communities because I'm noting myself as a person of color and seeing the number of alcohol outlets, the number of the lack of walkability in terms of sidewalks, the number or lack of street lightings, those things that are important social factors to health and the impacts of health, and ensuring equitable and I want to say communities that feel that they're seen and that their social needs are being addressed as well. And so you asked why is alcohol not necessarily seen the same way as others? And I think that it's a hidden risk factor to the way that we think about it. Alcohol is consumed differently. Alcohol it's socialized in the media. And so I think it's sold. So there's many issues, Josh, and many reasons for that. But I think all of that is the way we think about alcohol in this country. It's at every sporting event, every celebration is available. The opportunity, right? Like we even have limits in terms of what percent says that you are, what percent are you if you are not necessarily intoxicated, right? And so we have markers for all of these things relative to alcohol, and that's not necessarily how we think about other substances.
It's interesting. One of the great pleasures of being affiliated with Hopkins and the consortium is discovery. And this report really opened my eyes to a lot of things that I didn't know. So thank you for all of you for being part of that. So I appreciate that. There's so many great questions. Michelle, just to finish up this thing, there was a question about gun violence and alcohol density. I think that's what you were getting. That and just quickly talk about, finish that thought. Real, you mentioned alcohol density briefly, but I just want to answer this question. Alcohol density matters, right? There's research about this. Outlet density.
Oh, absolutely, right. And so Baltimore City and Baltimore City is a great example. The Baltimore City Health Department many years ago did a report on, I think it's the neighborhood health profiles. And in the neighborhood health profiles, it outlines these types of densities, alcohol outlet densities, for example, or the number of unoccupied homes, for example, or the number of green spaces or alleys. And I think it's certainly, if you care to, please take a look at some of those reportings, because it really shows the impacts and life expectancy of where alcohol outlets are in particular communities versus other communities. And we know here in Baltimore City that Baltimore is made up of neighborhoods, and it's made up of neighborhoods are small. And you can see the number of liquor stores in particular communities here, and what does alcohol outlet density means in terms of life expectancy, in terms of health in that particular community, in that particular neighborhood. And where is those alcohol outlets relative to schools, to parks, to faith-based organizations, and what does that all mean? And so, yes, Josh, the number of alcohol establishments in particular communities are absolutely important when we think about overall health.
Thank you. And then Sylvia, maybe just talk about some of the recommendations in the report that relate to sort of alcohol limitations, environmentally speaking.
Yes, of course. But also want to add some interesting data about alcohol outlet density to complement what Michelle just said. So we know now that limiting alcohol outlet density decreases the availability of alcohol, but it can also limit the opportunities for drinkers to interact with one another. So this in turn, there's evidence that says it might reduce excessive alcohol consumption and related harms, and including violence and alcohol-related crimes. And Michelle gave the example of Baltimore, and there's a really good study where the firearm homicide of Baltimore, where the firearm homicide rate is the second highest in the country and 8 times the national average. And in this city, there's a significant negative relationship between alcohol outlet density and life expectancy. So just to your question now, our 3 policy recommendations that are related to the environment where alcohol is sold and consumed is limiting alcohol outlet density through the use of regulatory authority, and this is licensing and zoning. And the other one is limiting the hours and days of sale on which alcohol is sold. And the third one is increasing the price of alcohol by raising taxes.
So there's a question about how is raising taxes important in this issue, and so just noting there's a question about that, and I'm trying to answer that. So thank you very much for that. Turning to some of these questions, back to them. Can one of you, anybody can jump in on this? The risks, and Rose, you actually mentioned this, but the risks of alcohol and suicide, and firearm suicide. What do we know about that? We tend to think about alcohol as a disinhibitor. It can make you angry, whatever, but it also appears to have a role in suicide, specifically firearm suicide. What can you tell us a little bit about that?
I can just briefly say that we did, and this study was led by Julia Schleimer at our program. She looked at the risk of suicide following purchase among not just among the 80,000 handgun purchasers that we had been doing these studies with, and she found that the risk of suicide doubled for those who had DUI convictions at the time of purchase relative to people who didn't have any arrests or convictions at that time. And it was particularly elevated in that period right after the firearm purchase. And so we do see a link even with the sort of indicated that this proxy of DUI conviction.
Wow. Okay. Thanks. So there's a pretty clear link there. and doubling is like 100%, so it's a big risk factor, right? That's yeah. So okay. Thank you very much. Michelle, Chris Thomas asks, could you restate the 5 areas of the Bahi Initiative?
Sure. Thanks for that question, Chris. We focus on addiction and overdose, adolescent health, environmental challenges, food systems, and violence. And we know that they are interrelated and interconnected in many ways. And I will be remiss if I didn't mention our 3 cross-cutting areas by which we do this work, which is equity, evidence, and through policy.
Great, thank you, Michelle. I appreciate that. So let's go to, there's a question about, I want to drill down this. Why two DUIs? Maybe why not one? There's also, maybe I'll answer with the second part of this is, how do I think this will withstand the Bruin challenge now with the new Supreme Court decision in Bruin? But let's start by why 2 DUIs on this? Why not one?
I can speak to that. So from the research and data that we have in the report, we found that there's data from the FBI and CDC that estimate that people who get arrested for DUIs have driven drunk around 80 times. And you need to take a seat to digest that. So that is a good indicator that most of these people have an alcohol dependence problem. But there are also people who make mistakes. And considering this, we also assessed some of the state laws that are existing, and they have different thresholds. So what we are recommending specifically with 2 DUIs is to temporarily prohibit firearms to people who have 2 DUIs for a period of 5 years.
That's helpful. I think, I'll jump in, put my lawyer hat on the Bruin side here, which is the NYSERPA versus Bruin, which is a new Supreme Court case decided about a year ago that sort of has upended a lot of Second Amendment jurisprudence. I do think that the DUI prohibition is likely to withstand this test. There's been alcohol prohibition since the new test in Bruin is text, history, and tradition at the time of the founding, which doesn't make a lot of sense because a lot of people didn't have rights at that time and we treated things very differently. But alcohol there's always been alcohol offenses. I think that there's a couple of other pieces there. So there's definitely the tradition, history and tradition there around alcohol. But I also think there's some important due process issues here, which are DUIs are full trials where people get to present evidence. There's a judge and there's standards of evidence that are met. And here there's 2 of them. So you have to have 2 times that you've been convicted of a DUI offense. In many states, that actually by the time you get there, you're in a felony situation. So those are the types of offenses that the courts have overwhelmed, even post Bruin have said their firearms prohibitions can meet Second Amendment challenges there. But the other thing is they're time limited to 5 years. So you've got history, you've got due process, you've got time limitations. So I think that they're likely to withstand challenges. Now, there may be some outliers. We've seen courts do things that have been very confusing in the post-Bruin world, but sometimes there's a lot of publicity gets to one of the outlier cases and not to. There's just so much going on right now that we're tracking. But I think in the end, I think 2 DUIs is likely to withstand a Bruin challenge in the court. So I could be surprised, but I think we're going to survive on that one, and so I think we'll be okay. And I think for advocates and policymakers, this should be something they really consider as something that is evidence informed, evidence based, but also likely to withstand Second Amendment challenges. I have a question from Sarah True from the Baltimore Banner. Are there gun violence prevention programs that you know either locally or nationally that focus on alcohol misuse, and have these been evaluated? I personally don't know of a program that's just just based on gun violence and alcohol. I know that there's lots of other programs. I'm sure Michelle might know of some that are going on in Baltimore and other places, but I don't know one that's like a intervention program just focused at the intersection of gun violence and alcohol. Although one of the reasons we did this report is to start focusing on intersection and putting some, at least some policy recommendations in there. But I don't know if others wanted to jump in there. Michelle or anybody, any of the speakers, with anything related to sort of alcohol mitigation programs, either Baltimore or nationally.
Yeah, thanks for the question, Tracy. I don't know of a specific gun violence program that focuses specifically on alcohol. I am thinking about programs such as ROCA or the violence intervention programs, but those don't necessarily have a specific focus on alcohol, but certainly would be inclusive of substance use disorder, and certainly would be focused on treatment and behavioral health and opportunities for individuals that would be part of the program. But that focuses specifically on alcohol, I'm not aware.
Okay.
And it's a great question for us, Josh, to maybe go back and think about and follow up with.
Yeah, absolutely, absolutely. We got a question if the DUI conviction prohibitions would be impacted by the Good Samaritan laws. So we have a Good Samaritan law in Maryland that allows for reporting when someone's in an overdose situation. I don't think so. I don't know if that's. I don't know if there's. I don't know if anybody knows any about that intersection. I don't think there's been an intersection there because we're not asking individuals to report. We're asking for either environmental changes or prohibitions, temporary prohibitions related on certain specific convictions. Okay. Let me ask a question about, there's a link between alcohol misuse and gun violence. Any thoughts about why states have, maybe this goes back to the sort of hidden question, Michelle, but why do you think states have been reticent to bring this up? I know maybe, Rose, you followed, I think California has attempted this a few times. I don't know, it's been a little difficult. One of the reasons we do these reports is to put information in the hands of advocates and policymakers. But I think part of this may go back to the idea that alcohol sometimes is more socially acceptable, although the risk of harm seems so high. Any thoughts about why legislators haven't addressed this?
I can speak to the experience in California just a bit. One of the things with California is that, and that group of 80,000 handgun purchasers that I keep talking about, it's actually a really unique sample because in California, we have a firearm prohibition for people convicted of violent misdemeanors. And so it turns out that there's actually a lot of overlap in terms of the people with DUI convictions and the people with violent misdemeanor convictions. And when we looked at the actual numbers when this bill was being considered in California of how many people meet the threshold of something like 2 DUIs in 5 years or 3 DUIs in 10 years, who aren't already prohibited for other reasons and are seeking to purchase a firearm, the numbers were remarkably low. But, again, this is a very unique sample in California, and the numbers actually look very different when we look back in time at purchasers in California prior to our violent misdemeanor conviction prohibition. And it's logical to think that these numbers would be very different in states with a different policy environment.
All right. And I think it's important to note that alcohol, while DUI prohibition is a big piece of this, it's not the only piece of the sort of policy prohibition. So Sylvia, you want to talk about, just mention briefly mention briefly, some of the other sort of policy prohibitions we have in that?
Yes, of course. So we have, as I mentioned, our 2 broad policy recommendations, and each of those recommendations have very specific recommendations. So the first one, the broad policy recommendation is limiting access to firearms by persons with a record of alcohol misuse. And our first policy recommendation about that is temporarily prohibiting the purchase and possession of firearms by persons convicted of 2 or more offenses of driving under the influence within a 5-year period. But also, we need other complementary policies for this policy to be effective, and that is states should adopt concealed carry laws to temporarily prohibit anyone with a court record of alcohol misuse within the past 5 years, as we mentioned earlier, from receiving a concealed carry license. The other one is ensuring that alcohol offenses that are firearm prohibitory under state or federal law are entered into the NICS system in a timely manner. And I think Rose mentioned that really briefly, that it really depends on background checks. And the other part that are really related to this recommendations that we just said is that states need to provide funding for education about this intersection of alcohol-related convictions and gun violence. And that could include courses and materials for different actors that are involved in the legal systems, like judges, prosecutors, or lawyers. And the other one is that courts should consider evidence of alcohol misuse as a factor when making the determinations that affect decisions about firearm prohibitions.
Well, thank you. I'm going to ask, no one has to respond to this, but I thought Grace Hauk has a great final question for us, for our panel. I understand this report is geared toward professionals and policymakers. For everyday Americans, what are the implications of this report? What should they take away, and what can they do? What a great question. Thank you, Grace.
I think that's a great question, and I can start answering that. So, yes, alcohol misuse is a risk factor for gun violence, and we provide policy recommendations. But I think one huge part of why we did this is that there's really not a lot of awareness on the data and how many people are affected by this. So we know I already gave some data and statistics about homicide perpetrators and people dying by suicide, but also you are more likely to become a victim of homicide or other violent crime when you're in a place or entering a place where alcohol is consumed and guns are present.
Note to self, stay away with places with guns and alcohol are both together. That's a very sound piece of advice. Rose, Michelle, did you want to join in for final closing on that question and that reflection?
Yeah, I would go back to what we chatted about earlier, and that's when we think about our research and policy approaches to this work, that we need to check our own biases, and we need to be aware of what we bring as individuals to the space of gun violence and to the space of alcohol misuse. And when we're thinking about the communities that we are drafting and thinking about policies of implementing and strategizing around policies, that we think about our own biases that we bring to the table, and that we are equitable in the way that we approach our work.
Before I go to Rose, there is a question in the chat, in the Q&A for a link to the report. Meredith, I think, or Sylvia, I think it's safe to say we can, if we have email addresses, we can email that out. It's also on our website, the Johns Hopkins Center for Gun Violence Solutions. You can find it there. That's probably the easiest way to get it. If you can't, we'll get it for you. Rose, last word.
Yeah, so, we found that DUI convictions are a marker of risk for interpersonal and self-directed violence in our studies. And it's just great to have the opportunity to see this work in translation in this report and today. So thank you very much for the opportunity.
Well, thank you for a fantastic panel, for all the hard work that you did to make this report a reality, for all the hard work that you do every day in the communities and in the gun violence prevention space. So thank you for panel. What a great job. And as I said, this is being part of all this is a journey of discovery for me, and I'm sure for the audience. And so thank you for doing that. And I'd like to thank the audience for this great participation and for great questions. So thank you, and please email us and be in touch. We are here to answer questions. If there's education that needs to be done for advocates, policymakers, the media, we are here to answer those questions. And thank you for your time today. And again, thanks to the Joyce Foundation for providing the opportunity to do this work.